Hi, can everyone hear me?
Yes.
All right. Oh, thank you very much. I'm kind of losing my voice, so if you can't hear me just throughout this, you want me to repeat something, can you please just raise your hand and I'll repeat it? I did have a full presentation on my current literature review that I've been working on for the last 6 months. Because of my voice, I'm going to do an overview and then I'm going to put it to the floor for some questions. So that I could answer some, direct inquiries regarding my research as a whole. So today I'll be talking about cannabidiol, CBD, and autism spectrum disorder. My thesis is actually focusing on using CBD for improving psychosocial symptoms in autism spectrum disorder, but this lit review just analyses the current research and what they've been looking at. So, firstly, I would like to acknowledge the traditional custodians of the land on which we meet today. I would like to pay my respects to elders past, present, and emerging, and all Aboriginal and Torres Strait Islander people that are here for today's conference. I'd also like to say a big thank you to the Southern Cross Postgraduate Association for having me, as well as my RTP scholarship, the National Centre for Naturopathic Medicine, and my supervisors. So I'm working with Dr. Janet Skolos, who is a research fellow at the National Centre for the National Centre for Naturopathic Medicine. I'm also working with Dr. Kitty Foley, who is a lecturer here at SCU in occupational therapy, and she did her doctorate in autism. And I'm also working with Dr. Caroline McCallum, who is actually a clinical instructor for the Department of Medicine, Pharmacology at British University of Columbia, and she's actually a doctor at Greenleaf Medical Clinic, who have actually been prescribing CBD in children, like to children with autism, for a number of years now. So that's over in Canada. So I'll give you the basic. Does everyone here understand, like, you have had interaction with autism spectrum disorder, you know someone? I just want to preface this talk with saying that I do, and my fellow researchers do, we respect that the autistic community prefer to have their symptoms referred to as traits and behaviours. However, we are working off the medical like the DSM-5 characterization of symptoms, and therefore I just wanted to put that I will use the term interchangeably between traits and behaviours and symptoms, and I'll identify them nice and clearly for you. So as you can see, 1 in 100 children worldwide have ASD. The etiology is still vague. We are with an idiopathic origin and several genetic environmental factors associated with the ASD symptomology. When we refer to the core symptoms of ASD, we refer to social interaction, social communication, and repetitive behaviours. Sorry. We've found that it's not, okay, hold on, I'm going back. I'm just starting again, all right? Pretty much, I can't read with the notes, okay? Pretty much there's not a lot of pharmacological intervention that targets these core symptoms, and therefore my research is going to aim to improve on core symptoms so that we can be more pharmacologically active when we do give pharmacological intervention in the medical setting. So why CBD? CBD, does everyone know what CBD is? Medicinal cannabis, non-psychoactive component of cannabis. It's got a lot of therapeutic benefits. All right, so this lit review, this is my abstract. You would have seen it, it's in the program. So the aims of the objectives was to evaluate the effects of CBD in our target population on traits and behaviours, because that's what it's been looked at primarily, is traits and behaviours, and synthesise the research pertaining to the safety and efficacy of CBD, as well as report on CBD doses, administration, and the types of CBD being used. So we followed the Prospero outline for protocol for a systematic literature review of reviews. I looked at a number of databases, including the search terms presented on the screen. Our inclusion and exclusion criteria. So our inclusion criteria is pretty standard, as you can see above, but the main exclusion was high THC dosages and no vaping of CBD. So that was our main exclusion criteria when looking at the reviews, as a lot of the research pertained to medicinal cannabis regarding to smoking and vaping. And we were trying to learn that because we don't have that here in Australia. So we've got to pertain to our guidelines. So we had 444 references imported, 120 duplicates, 324 studies screened by myself, and then they were also screened by Janet, post me. So we had 302 studies, 324 studies screened against title and abstract, 302 studies excluded, 22 studies were assessed for full criteria, like full text review. We then excluded 14 studies due to the above reasons, whether it was wrong study design, wrong population, wrong intervention, and as I said, the primary wrong intervention would have been high THC, or it would have been to do with vaping or smoking of medicinal cannabis. There was 0 ongoing trials and 0 studies awaiting classification. We had 8 reviews included. This is my overview of included reviews. So we've got this one, and then we've got a continuation. So there was 8 in total. And you'll see in the far column, studies included for extraction. So when we did the reviews, we ended up with 3 full systematic reviews and 5 that we extracted from clinical papers. So there were sections of clinical papers. So this is my continued overview of all 8 reviews and which ones were extracted and which ones, country of origin overview. Studies excluded. So these were the reasonings. So once we did the review, we then went into actually reviewing each individual study within our reviews. And obviously there was a lot of crossover with the ones that were being reviewed within the primary reviews. If that makes sense. Does it make sense? Am I making sense? Cool. So we extracted these ones due to the following reasons. As you can see, outcome measures focus on effects of different types of CBD. Great article, by the way. Really, really good article. But removed because the statistics were not representative of the population. It was just a case study. Use of pharmaceutical THC, which is obviously synthesized. So it's synthesized synthetic THC. And then removed due to the outcomes, again, due to structures and endocannabinoid pathways. Again, really, really nice study to read and great background information, but not pertaining to our lit review, unfortunately. And then we have our overview. So out of those, we had 5 studies left. These were our 5. You can see the different sources of CBD. You can see there is a lot of information missing from this table. And this is where I will lead further on into, I guess, where we want to go with this lit review. So this lit review was really just to summarise what is out there, what is being reviewed, and what people are using in studies. A lot of blanks. Commonly, we're looking at CBD THC 20:1 ratio, which is also what we use. We use CBD here, no THC. I won't go into THC. I would love to eventually look at that as well. Then we have our prevalence of traits and behaviours. So in the reviews, we looked at traits and behaviours, and this is this is a summarised of, you can see each article. Unfortunately, Mick Vigil did not disclose any traits and behaviours, but they did side effects. So we weren't able to do extrapolate any means from this, unfortunately. However, we did get a good overview of what was improved by CBD. And our main ones were problem behaviours, sleep improvement, and what else was there? Sleep quality and reduced frequency of dosages of co-contaminant medications. So a lot of people who have ASD or have co-occurring conditions will be on a range of medications from antidepressants, anti-anxiety meds, all the way through to antipsychotics. And the fact that CBD can, oh, I've lost my slides. It's all good, we're back. The fact that we can reduce that medication is pretty much the basis of my research and what I wanted to see in the literature, is because coming from community myself and having worked with a lot of people with complex backgrounds, we're at the ceiling for what we can prescribe in a pharmacological setting. So it was really nice to see that, and we have obviously a lot of others. In terms of adverse effects, we were able to extrapolate means from this one, which was really nice. I would have liked to do that in my behaviours as well. But we pretty much had the most adverse effects were restlessness, increased appetite, and funny enough, sleepiness. So we had a mean of 8% for sleepiness, a mean of 7% for increased appetite, and a mean of 12% for increased restlessness across studies. And how we did that was, if a study mentioned a adverse effect, so across the 5 studies, if it was mentioned 3 times, we were able to then extrapolate a mean. If it did it less than that, we weren't able to. So again, there's a good research out there, but not enough. There's still a lot of gaps. Discontinuation rate throughout, so it ranged from 7 to 27 in our discontinuation rate. And I will mention that there was one psychotic event in which they had to be treated with antipsychotics. However, I do remember from the study that they were on other medication at the time that could have contributed, and it was thoroughly written about. And it's actually in my paper. We went through that and made sure that it was clear that it could have been due to other medication at the time, and they ceased CBD quite quickly after intervention. What else? Ongoing trials. There's a multitude of ongoing trials. So this is one that I did. So at the time when I did the review, there was only one, which was at Iran 2021, which looked at the different types of CBD, which was awesome. These are currently what is available at the moment, and it looks at a variety of things in regards to problem behaviours, structures and pathways, brain functionality. It's amazing research, but still does not hit what I would like to do. So obviously the outcomes from this, we saw improvement in behavioural problems, communication abilities, and seizure frequency. Home situation questionnaire, which is one of the outcome measures, improved by 29%, and autism parenting stress index was improved by 33 and 1. Use of concomitant medication decreased or ceased post-intervention. And then we have a decrease in behavioural problems and stereotyped behaviours, along with improvement in expressive language, cognition, and social interaction in participants who adhered to the 2-year study. And that was the Bar-Lev-Schleiter, I can't say it right, one, and that was 1 minute. Oh God, okay. Future directions. Okay, I want to do my thesis. I'm a master's student, and I really, really would like to, I want to pretty much, as I said in the beginning, I want to be able to look at this research and target those core symptoms. I've been in community, and if I can, this review enabled me to be able to look at what's available and direct my next 2 phases of my PhD, which is a cross-sectional survey of our Australian population, autistic Australian population, and their thoughts and behaviours, whether they're using CBD for anxiety, depression, whether they've thought of using it, what they're currently using. And then I'm going to do a pilot trial, and then eventually hopefully a full trial. And look at all the different ways that we can administer CBD to the population, and then hopefully be able to push that into complex behaviours. Thank you. Awesome. Questions?
Well done. Well done. Let's open it out to questions and comments as well. Shay?
First of all, I want to say thank you for your presentation. It's very important one for the work that you're doing.
Thank you.
In this area, and as fast as you can do it and get it out there, the better. Because I really believe in what you're doing. I was very, very interested in the changes in parent stress index of people who are parenting people in ASD. Is that something that you're going to be looking at more in your study, or is that something that's a bit to the spot?
No, 100%. Like, so we're doing a cross-sectional surveys. After this lit review's out, the next one is a cross-sectional survey, and we'll be looking at adults and caregivers, because we can't, obviously, I would love to have looked at adolescents, but ethics to get it through quick enough so I can get through this year wouldn't pertain to it. So I would really like to look at parenting stress, because as a carer myself, we want to open it up to carers as well, carers of ASD, and eventually, in the very long future, I'd like to do my postdoc in intellectual impairments and CBD, or psilocybin, and like recalling traumatic events in therapy. So
already thinking about postdoc.
Oh yeah, I'll just I'll just be in uni forever, eh?
There's another question up back there, yeah.
Probably for me, it's pretty broad. It doesn't actually look at very core symptoms, unfortunately, and that's where I would like to really target eventually my pilot trial, and then my full trial is looking at core symptoms. It's very much those traits and behaviours on the side. So whether it's like aggression or restlessness, or like, that's what those studies were kind of more looking at than actually your core symptoms. But seeing improved social communication, cognition, I love to see that. It wasn't hugely big, because obviously it was only 1 or 2 studies, but to be able to see it I knew I was in the right direction in what I wanted to do with my research. So it was really interesting to do it, and it helped drive the process to where I'm going next with it.
Okay. Oh, last one.
Oh, thank you so much. I try my best. I have like a bad imposter syndrome, hey.
Thank you so much, Maddison. Well done.